Good morning. My name is David Godfrey. I'm a urologist in Bradford, Pennsylvania. We're taping this live for our hospital system. So I'm here to introduce myself and talk a little bit about what we do in the office. So I've been in Bradford and Olean area since 1987. I was board certified in 1985, and I've been recertified 3 times now through 2025. My office is in the medical office building adjacent to the Bradford Regional Medical Center, and I see patients in the office here every day. I do surgery on Wednesday mornings and all day Friday, currently at the Bradford Hospital, and beginning sometime after the COVID virus issue is resolved, I'll be doing all my surgery at the Olean General Hospital in Olean, New York. The philosophy of my practice is really facilitating the quality of life for men, women, and children with urologic problems. And we basically treat newborns to the very elderly. We even have some patients in our practice that are over 100 years old. So we've really covered the length and breadth of ages in our practice. I and my staff, I have 2 staff members, Jill and Amy. The philosophy of our practice is to be patient-oriented with timely appointments. For urgent problems, we try to see people the same day. And our goal is to really have same-day service for imaging studies, laboratory studies, and to review your findings and make recommendations in a timely manner. My wife and I have a farm in Limestone, New York, so when I'm not working here, I'm on call for the farm, but most of the time I tell my wife, don't call me unless they're dying. And that works out pretty well for both of us. For men, we treat benign and malignant processes involving the prostate. We recommend that prostate cancer screening be done in men between the ages of 55 and 70. And if you have a family history of a first-degree male relative, we recommend that you have screening done beginning at age 40. Ultrasound and biopsy we do here in the office under a local anesthetic is generally well tolerated, and we usually have the results back in several days. The treatment of erectile dysfunction involves a review of systems, laboratory studies, and a physical examination. And generally, we're looking for underlying causes for problems with erectile dysfunction, particularly cardiovascular diseases, which may be initiated generally with seeing problems with erections, may indeed be a sign that there's going to be problems with heart disease or stroke in the future in patients that have underlying conditions that may contribute to those processes. Usually, treatments include oral agents, or urethral suppositories, or actually patient injection therapy into the penis. And if those are not successful, the patient can be referred for penile implants if required. I perform inguinal hernia repairs for patients that have inguinal hernias. Generally, it involves a 4-centimeter incision, mesh repair, and generally home the same day, usually with minimal morbidity and a fairly quick return to normal activities. We also treat people with kidney stones in terms of their acute episodes, assessing the degree to which they have disease, and try to prevent further stone formation in the future. And generally, this involves medications, potentially interventions to relieve acute pain, and lithotripsy management for patients. And in selected cases, they may require ureteroscopy and laser fragmentation of the stone. I treat patients with bladder cancer. Generally, we're doing transurethral resections of bladder tumors to identify the type of tumor and the degree to which it involves the bladder. And generally, in these patients, use medications to prevent or lower the recurrence rate of these tumors. In patients that require major bladder surgery, they're referred to a tertiary center nearby. I perform elective sterilizations in patients here in the hospital under local anesthesia or IV sedation. And we also do vasectomy reversals in selected patients. Treat urinary problems in females, generally in premenopausal patients, problems with recurrent infections after sexual relations, and in postmenopausal patients, often lack estrogen in the vaginal tissues, which may lead to many different problems in terms of vaginal dryness, symptoms of urgency, frequency, and dysuria in the absence of infection, and various types of incontinence, including stress and urgency incontinence, which may require medical therapy as well as surgery to manage these problems. Common urology problems in children, particularly in little boys, include meatal stenosis, glandular adhesions after neonatal circumcision, undescended testes, hernias and hydroceles, and in little girls, urethral stenosis, recurrent infection, and evaluating for congenital anomalies like vesicoureteral reflux and ectopic ureters. In adolescent males, we may evaluate patients for varicocele in terms of pain or infertility. And if these are present, they may require surgical repair to alleviate that problem and improve fertility and relieve episodes of pain. Urologic emergencies include urinary retention, gross hematuria, ureteral colic, obstructive pyelonephritis, torsion of the testicles, gangrene of the testicles, and priapism, and urologic trauma. And all these are available here at our hospital locally. In summary, we place an emphasis on appropriate, timely care with prompt diagnosis and treatment for these problems, often in the first visit. So I'd like to thank you for your attention. If you have any questions, we're certainly available here every day to do such. Thank you.